Good afternoon, everybody. And at the very outset, I'd like to thank Hoya people for giving me this opportunity. And the topic allotted to me for this talk is Hoya WaveNext platform. How is it different from other platforms? I have no financial interest in the subject matter of this talk. So it's not moving forward. Okay, I'll just. Okay, so what is this Hoya WaveNext platform? So we will divide the talk in three subsets. So this platform, WaveNext platforms, has new features with new lens design. It's a new hydrophilic acrylic material with almost gristling-free material, and this has a new delivery system as well as it probably has a least of posterior capsular opacification rates. So this is what the lens looks like. And before we go into the details, first of all, we will discuss the lens design. As we all know, mostly the lens grossly corrects the lower order aberration in the form of defocus or astigmatism. And these two lower order aberrations are responsible for 80 to 90% of the optical defects, which we are trying to correct by doing IOL surgery or any other type of refractive surgery. And out of these 10 to 20% optical defects are because of higher order aberrations. Out of these higher order aberrations, coma and spherical aberration account for around 10 to 20% of the optical defects. And out of these two, I mean, the impact of coma as well as spherical aberration on image quality is quite significant. As you can see, the coma leads to little ghosting and spherical aberration leads to a small halo around the images. And there is a naturally occurring ocular coma in all of us, which exists within the human eye, as has been shown, and it also increases with age. And also with increasing amount of cataract, it has been shown that the degree of coma in the eye increases. And this naturally occurring coma in the eye is because of the shape of the cornea. It also has a vertical and a horizontal component. And it has been shown that the internal optics of the crystalline lens compensate for corneal induced coma. And as we all know, the spherical aberration could be a positive spherical aberration as shown on the right side, or it could be a negative spherical aberration. All of us, the combined eye spherical aberration is around 0.1 micron. Cornea has plus 0.27 on an average, and lens has in the youth of life has around 0.2 minus 0.2 micron of spherical aberration. In young age, the lens has negative spherical aberration, which partly neutralizes the positive spherical aberration of the cornea. And as the lens age advances, the spherical aberration of lens becomes positive and it reduces the quality of vision, as we can see. And cataract surgery is an opportunity to manage this spherical aberration. As we have told, it is average between 0.27 to plus 0.3. And aspheric IOLs are designed to improve the quality of vision by compensating this naturally positive spherical aberration of human cornea. But the effects of coma on image quality is not routinely considered while doing a IOL or a phaco surgery. And as we can see in this cartoon, the conventional aspherical IOL targets only aberration balancing between lens and cornea to reduce the spherical aberration so as to improve the quality of vision as well as the contrast sensitivity. This is one example of the two eye of a person. One eye has a normal lens, other eye has aspheric lens, and you can see the quality and point spread function is much better in the aspheric lens. But one of the disadvantage of aspheric lenses is once there is a decentration of these lenses, it leads to a more induction of coma aberration in these eyes. And effect of decentration is more in aspheric IOL as compared to a spherical IOL. Similarly, if there is a tilt, that also induces a coma, which is much more evident again in the aspheric lenses as compared to the spherical lenses. So sources of coma, naturally occurring coma, remains unchanged during the cataract surgery, as the difference between the visual axis and optical axis remains unchanged. The correlation between IOL placement of the visual axis and coma is also to the significant amount. Induced coma has been shown to be higher in patients implanted with aspheric IOLs than in spherical IOLs. And unlike spherical aberration, coma has not historically been considered at the time of doing a cataract surgery. It's not moving forward. Okay. So coma occurs because the visual axis and the pupillary axis are not in the same plane, because there is an angle between the two, so there it induces a coma. And choosing an IOL with optics that considers spherical aberration and coma should be the optimal choice. And Vivinex platform provides minus 0.18 micron of spherical aberration, and this partial correction of spherical aberration of the human cornea maintains the patient's field of that. But how to, does it tolerate or somehow counteract the effect of coma, naturally occurring coma, or because of the displacement of the lens? Let us see. The ViewNext platform is designed to have a minimized impact of coma on image quality. There are two distinct aspheric elements in the center of the IOL which work in harmony. The central 1.2 millimeter of optical zone induces a positive coma by using a convex meniscus structure there, while the 1.2 millimeter area around it induces an equal and negative coma through a concave meniscus. So the combined effect is, what we see is it improves the image quality by counteracting the decentration effect as well as tilt effect. You can see it counteracts in opposite direction and you get a minimal distortion of image. And it has been shown in various studies that ViewNext platform is more immune to optical degradation caused by decentration when compared to other two platforms. There was a minimal amount of uh, maximal tolerance to decentration with the ViewNext platform. Then coming to what is new about this platform is available in preloaded cartridge, which is called new ISET as of now. Recently, they are coming out with a much more efficient. I'll come to that later on. This is a preloaded platform in a ISET cartridge, and the advantages of this preloaded cartridge is there is no direct handling of the IOL. The sterility is maintained, and cartridge goes through the 2.2 incision easily, and it is a single-handed screw type of injector, and the injection is very predictable. Chances of endophthalmitis are much less as there is no contamination of the lens, and it has the enhanced safety for IOL insertion. And this is the new multi-set injector. The advantage of this new multi-set injector is we can use it as a push type of injector as well as screw type. If we want to use as a screw type, you can screw it from here. If we want to use as a single hand use, you can push this plunger and it goes smoothly. This is going to be recently launched by the Hoya people. Uh, and the advantage is you can adjust this length of nozzle also. If you want to directly implant the lens within the bag, you can increase this length. If you want to deliver outside the bag, you can control the amount of this nozzle project inside the anterior chamber. Then now coming to how this platform helps us in preventing PCO. It has a unique design, and it has a the square edge, which is most, compared to other lenses, it has the best square edge and almost a perfect square edge, which prevents the migration of epithelial cells. And it is a hydrophobic acrylic material, and the posterior surface of this material is ozone treated, which makes it more adherent to the posterior capsule. And because of this adherence, these epithelial cells fails to migrate to large extent between the cell and the posterior capsule, so that there is a prevention of PCO. And the clinical data is there on the files, which has shown that as compared to other platforms, the PCO rates are much less with Vivinex. And this is one study from Japan, which shows that 4 years YAG capsulotomy rate with Hoya Vivinex were much lesser as compared to the other control platform. Also, there are studies on record. Recently, a study was there in January issue 2021 American Journal, where they have compared two eyes of the same patient in almost 40 patients, where they put Hoya Vivinex in one eye and another platform in other eye. And after 3 years, they found that YAG capsulotomy rates were almost half as compared to the other platform. So to summarize, this Hoya Vivinex platform has a proprietary aspheric optic design. It neutralizes corneal positive spherical aberration. It also tolerates anatomical misalignment and compensates for the coma aberration, which other platforms fails to do. And it has a unique preloaded delivery cartridge system, which helps us to increase the workflow and prevents endophthalmitis. And also it further reduces the PCO rates and JAK capsulotomy rates as compared to the other platforms. Thank you so much for patiently.